Do you ever have trouble speaking your mind? If so, in this video, I'm going to offer you some strategies to begin to recognize what you might be doing in your body that's inhibiting your voice. Now, right from the beginning, I understand that the reasons we don't say what we want to say often have to do with the other person we're with, the situation we're in. Maybe there's some fear involved or all kinds of things related to your confidence and just what's going on in your world right now. But it's also going on in your body. If you have a habit of not speaking up or keeping inside what you have to say, there's something you're probably doing in your mouth, in your throat, and in other places. And we can begin to recognize those bodily signals of inhibiting the voice. And when you understand how to let go of some of those physical manifestations of keeping the voice inside, you might just find that the way you show up, the way you breathe, your posture, the way you feel inside your skin is different when you come to that moment where it's time to speak. Hi, my name is Seth Dellinger. I am a Feldenkrais practitioner located in Washington, D.C., and I especially love to help people find their voice. So if this video begins to open things up for you and you want to keep going, you can look at the link below where you can book a free call with me to see how I can help you one-on-one. Okay, so let's begin with a bit of an exploration that's just going to help you to sense some of the important factors in freeing your voice. First of all, find a comfortable place to sit with your feet firmly planted on the ground. See if you can find your sit bones underneath you. Have a little space in your belly, a sense of a long spine, and an easy breath. Now, before we begin, I'm going to ask you to do something that's going to give you an overall sense of your comfort in this moment with using your voice. So what you're going to do is draw in a breath as if to speak, or if you like, you can imagine singing a tone, but you're not going to do it. You're just going to draw in a breath and then open your mouth as if to speak, and you sort of feel the impulse, but don't make a sound. Just imagine your voice and imagine how would your voice move out into the space. How much would it resonate? Would it fill the whole space that you're in? Or would it sort of be this small little thing that doesn't quite fill up the surrounding space? Okay, and then once you have a sense of that, let's try a little exploration together. What I'm going to ask you to do is just slowly begin to open your mouth a little bit and then close it. And you're going to keep doing that. So it can be very small in the beginning, just like parting the lips, right? So I'm going to continue speaking to guide you, but you just open your mouth a little bit and close. If you try to open your mouth like you're about to take a bite out of an apple, you might feel some discomfort in the jaw, something like that. So begin very small. But as you go, just really be present to the sensations of opening the mouth. And then you can pause, you can allow the lips to come together. Make sure you can feel your breath flowing in and out of your nose. And then again, open the mouth gently. And as you keep doing this, I'm going to invite you to bring your attention to a few specific places. And I think what you'll find is as you move your attention, the experience of this repeated movement is going to change somewhat. So just notice now that you are enlarging the distance between your bottom teeth and your top teeth. So just feel that change in the distance between the upper and lower teeth. And now bring your attention to what's happening between the teeth just on the right side. So of course both sides of your mouth are opening, but you're really thinking about the teeth on the right, moving away from each other each time you open the mouth. And of course you can gently close the mouth. But just notice what it's like to really focus on the right side of your mouth as you do this. It might open up a little bit of a different feeling in the right side of your jaw, just in front of your ear here. Okay, pause for a moment. Just notice if something feels slightly different from these couple minutes of opening the mouth, and in particular you're paying attention on the right side. And now go back to that. Stay with the right side of your mouth. But now think of the inside of your right cheek. So not out here, but on the inside. And just feel how the inside of the cheek, it stretches a little as you open the mouth. Okay? And notice if this is a different feeling when you're paying attention to the cheek than when you were tracking the distance between your upper and lower teeth on the right side. And so now go back to that. Track the movement of your teeth on the right, away from each other. Just feel the sensation. And then go back to feeling the inside of your right cheek. Okay, and now, can you pay attention to both of those things at the same time? So you're aware of the inside of your right cheek and the increasing distance between your upper and lower teeth on the right side each time you open your mouth. And then you close. Still making this movement gentle. Maybe you're opening a little more by now, but just keep it simple. And then pause again. Just notice, with all this attention on the right side of your face, does something feel different? Maybe not just around the mouth, but maybe around your right eye. Maybe there's something that feels different on the right side of your throat or your neck. Okay, so now go back to slowly opening and closing the mouth, but bring your attention over to the left. And begin with that feeling of the distance between the upper and lower teeth. And it probably feels different with your attention over here. Most people, for example, when they chew, they tend to chew on one side of the mouth, so don't be worried if it's a different feeling one side of the other. But just feel how it is for you. And as you continue now with the attention on the left side of your mouth, begin to focus on the inside of your left cheek. Once again, noticing if that sort of changes some small relationship inside your mouth, changes the sensation of what you're doing. Breathing is simple. Go back to noticing the distance between your upper and lower teeth on the left. And then see if you can incorporate the sense of the teeth as well as the inside of the left cheek. All right, and if you'd like to, you can rest a moment. But then I'm just going to invite you to open the mouth a few more times. And one time when you make the movement, you think of the left side of your mouth, the inside of the cheek, and the distance between the upper and lower teeth. And with the next movement, you think of the right side. Again, you might feel some small shift or change in how you're holding your jaw, something like that, so that it feels a little different when you think of one side versus the other. And then think of both sides of the mouth together. Think of the whole mouth, the stretching of the insides of the cheeks and the movement of the upper teeth and lower teeth away from each other and back together as you gently close the mouth. Okay, so one last thing in this process. Again, you're just going to continue opening the mouth. But think about when you speak, you're resonating your voice in your throat, right? In your vocal folds. So even though you open your mouth right out here in front, every time you speak, this is where the voice is. So try opening your mouth a few more times, but now imagine it's as if you had a little mouth in the back of your mouth. And feel how you open at the top of your throat. Okay? Open the top of your throat as you open your mouth. And now leave your mouth open just a little bit and just think of that imaginary mouth in the back of your throat. And open and close in the back while keeping your lips slightly parted. But see if you can feel how you can create an opening back there, or you can close the back of your throat, right? And this is the piece that we're going to notice, because a lot of people have a restriction at the top of the throat, in the back of the mouth. And so now, just to really emphasize this, think of opening and closing the back of the mouth, and then close back there and kind of keep it closed. And just notice, what's it like to breathe there? Because even if you're breathing through your nose, the air needs to pass down through the throat. And then if you have this idea of closing that imaginary mouth at the back of your throat, and you try to actually open your mouth, part your lips, you can do it, but see if you can feel that just this movement that we've been doing, if there's a sense of restriction at the back of the throat, it gets a little harder to open the mouth, doesn't it? So now, again, open the back of the mouth as you open the front of the mouth. Okay, very nice. Do you remember what you did at the very beginning, where you drew in a breath and opened your mouth as if to speak without actually doing it? But then you imagined how would your voice come out? What would it be like? So try that again now, and even if you don't make a sound, just see if you have a different sense of your potential for creating sound with your voice, for resonating into the space around you. So now that we've really woken up the awareness of what's going on as you open your mouth to speak, and we've really identified the importance of opening at the back of the mouth, let's see what happens when you kind of cut your voice off. And so what I'm going to suggest you do this time is actually to sing a note, but then you're going to kind of cut it off. So it'll sound like this. Like, imagine you're speaking and then suddenly someone walks in the room and you don't want them to hear what you're saying, and you just, right? Just feel that sense of and stopping. And what you'll notice is you cut off your breath, don't you? You stop breathing for that moment. So you can also, if this is not something you want to do over and over, you can just imagine it, as we were doing before. Imagine singing a note, but then imagine stopping it. Bring your attention now to your tongue. So if you begin to sing, and maybe the tip of your tongue is somewhere close to the back of your teeth, what happens to the tip of your tongue when you cut the voice off? Can you feel that it moves a little backwards? Right? Now, don't worry about singing, but just try that movement. Touch the tip of your tongue to the back of your front teeth and then pull it backwards. And do that a number of times. And feel how you're actually moving the back of your tongue backwards. And can you feel that you're moving the back of your tongue kind of down into the top of your throat? If you were to keep your tongue so that the tip wouldn't touch the front teeth, you sort of keep it retracted like that. Right? What's it like to try to sing from there? So, all right, hopefully that's clear. But so there's this movement that often happens of the tongue moving backwards, and it can happen suddenly and sort of cut off the breath and retract that space in the back of the mouth. Now, let's do something to counteract that for a few moments. So, hope you don't mind sticking out your tongue. That's what we're going to do. But not like a little kid, making fun of someone going, Let your tongue spill out of your mouth, nice and wide and relaxed. Might look something like this. Right? Just do that a number of times. And just get comfortable with it. If you like, as you did before, you can sort of feel the right side of your tongue, feel the left side of your tongue. But the main thing is just to let the tongue spill out of your mouth gently, and feel that you're still connected to your breath as you do that. And then pause. But now let's alternate between these two movements. So you're going to start with the tip of your tongue, kind of touching the back of your teeth, and you pull it back one time and feel how you sort of close the space at the back of your throat, and then let the tongue spill out of your mouth. And notice now the back of your mouth can really open. So if you had that little mouth at the back of your mouth, the movement of the tongue coming out, it really creates an opening there. So again, a few times pull the tongue back and then let it spill out. And pull the tongue back and let it spill out. Okay, and then if you like, once again, imagine that you're going to sing or speak, draw in a breath, and even if you don't make the sound, just imagine how would your voice resonate now, especially if you had that sense of the back of the mouth really opening, right? Okay, let's notice a couple of other things that might be going on if you're inhibiting your voice. So we're going to notice something about the larynx, right? This cartilage structure that's in your throat, and if you swallow, which of course cuts off the airflow so that the food can go down, you can feel that the larynx moves up. Now, you don't want to poke a lot with your larynx, but if you put the palms of your hands together like this so that any sense of coming together, the pressure goes here, then you can use your fingertips to just gently, if you start sort of further out and then just come in, you'll be able to feel the edge of your larynx here. Okay, just with the fingertips very lightly, but now as you open your mouth, can you feel that the larynx moves down? It can move a little down. And if you're very gentle, you can actually use your fingertips to just gently maybe open your mouth a little, and then you can actually kind of pull. You're not going to get a lot of movement, but through the skin you can actually pull your larynx a little down and feel how you're pulling it down away from the back of your mouth. And so can you imagine how you're opening the space at the back of your mouth like that? Okay, but what if you're cutting your voice off? So again, the heels of the hands together so you don't put a lot of pressure, but just lightly rest your fingertips on the edges of the larynx and then sing and cut off your voice. Ah, ah. And what you might feel is that the larynx actually goes up. It moves a little up. And again, if you just do a gentle, very gentle manipulation with your fingers, with the mouth slightly open, you can push the larynx a little up. And you might feel that by doing that, again, you're actually making a closure in the back of your mouth, right? So now just gently open the mouth a little and move the larynx a little up and a little down. Again, up to close, down it opens a little. And then you could move your larynx a little up and hold it there, and notice opening the mouth isn't so easy. But then if you maybe take it a little up but then let go and encourage it to go down as you open the mouth, how does that really open the back of the mouth? Now again, these are little things that you can do, but if now you just imagine your larynx, it's like a little elevator in an elevator shaft. And if you're just sort of sitting and imagine maybe you're with someone in a conversation, what happens to your feeling if you imagine the larynx sort of creeping up? Can you see how there's a way that if you kind of tend to inhibit your voice from coming out, you might actually be doing something where it's as if you're always lifting the larynx. So now can you just imagine the ability of the larynx to move freely inside your throat and think of it dropping, right? So we've talked about how the position of the tongue and the larynx affects the back of the mouth. Now let's try one more thing. So simply go back to opening and closing the mouth. And now feel the distance from the bottom of your mouth to the top of your mouth, especially in the soft palate. So that's a little further back. You have the hard palate right behind your top teeth, and then further back the dome kind of goes up. That's the soft palate. And if you begin to yawn, try to just begin, but not like do a full yawn. Think that you're going to yawn. You can feel the soft palate. It can actually lift. It's like it's lifting up under your eyes a little bit, right? Okay, so as you open your mouth now, think of lifting the soft palate. Or you could even just sort of let your mouth be loosely open and just imagine that lift. Or think of making the movement, but don't so much open and close the mouth. Just think of raising the soft palate, and can you actually feel that it makes sense, right? The soft palate is pushing up, and it lifts your head a little bit higher up on top of your spine. So knowing about the soft palate is actually a really great thing for your posture as well. But what happens if you're inhibiting your voice? So now put your attention on the soft palate towards the back of your mouth. Sing and cut the voice off. Can you feel that it kind of hardens? It kind of sinks? So you can think of it like a canopy that could go up, or it kind of comes down and like sinks like that. So if you harden the soft palate and kind of keep it tensed like that, try opening the mouth. But keep that soft palate tense. Imagine speaking. You can imagine that you were going to make a sound. How would it resonate if you have hardness in the soft palate? Okay, and now let's reverse that, right? Again, open the mouth, and let's put together all the features of what we've been talking about. So as you open the mouth, you can think about the lifting of the soft palate, which is also making more space in the back of the mouth, right? You can think about, even if you don't put your tongue out of your mouth, just imagine that the tongue could spill out, that the back of the tongue, it actually moves a little forward. Feel how the larynx can drop. And just this idea of opening a mouth at the back of the mouth. All right. So these are some places to really just keep some awareness. And you might notice you are with someone and there's a way that you kind of get small, right? You're not sure you can say what you want to say. And you see here that I'm kind of slumping in my spine. But if you kind of slump, you might notice what happens in the roof of your mouth. What happens to your tongue? Does it go backwards or does it go forwards? I think you'll find it tends to sort of fall back, right? The larynx lifting, the roof of the mouth kind of collapsing. And so these are places that you can then bring a different intention, to be lifted in the back of the mouth, to have space at the top of the throat so that there's a certain relaxation of the tongue, the larynx able to move in the throat, able to drop. And if you practice with these things, even though it might still be difficult to talk with that particular person or to stand in front of an audience, whatever the situation is where you find some difficulty with speaking, I think if you learn to carry yourself, to have a posture, including a vocal posture that's more ready to make sound, you might just find your voice after all. So I hope this was helpful to you. Again, if you'd like my personal guidance, please do get in touch. There's a link below the video, and I look forward to seeing you next time.